So this muscle is the temporalis. Then you have this muscle, which is the sternocleidomastoid. This muscle is the masseter. And this muscle that's here on the back side, this is the trapezius. Upper trapezius will go attached to the external occipital protuberance. So what we have right here, this is a cross section of the sternocleidomastoid. This large structure is the diaphragm. This large muscle that's here on the outside, so this is the pectoralis major. You have the pectoralis minor, which is deep. And then 1, 2, 3, 4, 5, 6, 7, and 8. This is what's known as the serratus anterior. The muscles, they sit like this, and they help to stabilize the scapula. So if you watch boxing, what you'll notice is that a lot of the boxers, their serratus anterior is like really prominent. And the reason that it's really prominent is because they're throwing punches a lot. So the action of the serratus anterior is obviously the first one, which is stabilize the scap. But when you throw a punch, the scapula is abducting. It's going away from midline. Compared to if I bring my arm backwards like this, the scapula is adducting. The serratus anterior is also known as the boxer's muscle. All of these are just cross sections of the ribs. What's in between the ribs is the intercostals. So costals means ribs. Like even when we say costal cartilage, right, we're referring to the ribs. Down here we have our oblique muscles. So you have external obliques and then you have the internal obliques. So the external ones are obviously on the outside and the internal obliques are here on the inside right here. The abdominal muscle that's deep to that is this. So this is what's known as the transverse abdominis. For these muscles, the way that they're named is based off of the orientation. The transverse abdominis is in this direction. So that's why if you look at the fibers, they're running parallel. Compared to the obliques, they're at an angle. And then we describe it based off of whether it's external or internal. The transverse abdominis is going to help to compress some of the abdominal contents. The obliques, they are helping to rotate the trunk. If you play baseball or if you play golf, the motion when you're going into the backswing, right, you're using your oblique muscles to rotate the trunk this way in order to, go through the ball. This muscle is known as the quadratus lumborum. So this muscle is in the lumbar region and it's shaped like a quad. You can see it there. This is the psoas major and the psoas minor, and this muscle that's on the inside is known as the iliacus. The quadratus lumborum is that for people that sit a lot, that muscle can get real tight. So a lot of times it gets stretched. So if you stretch down this way, what the action of the muscle is it helps to extend the spine. This is the flexion of the spine, and then this is the extension of the spine. The first thing that we want to do, whatever station that we're at, okay, whether it's an arm model looking at muscles, whether it's the bones, the first thing that we always need to do is what? We need to orient ourselves. You have to know what it is that you're looking at. What is anterior? Is this an anterior view? Is this a posterior view? What part is medial? What part is lateral? By knowing these things, this will lead you to the right answer. When I look at this arm model, is this an anterior view or is this a posterior view? It's anterior. This side, is this medial or lateral? This is medial. So that would make that, or this part, the lateral. Now we know what we're looking at. So this bone is the clavicle. Laterally, this is the acromion. On the posterior side, you have the spine of the scapula. The first muscle, this large muscle here, is what's known as the deltoid. So you have the anterior fibers in the front, the middle deltoid here in the front, and then the posterior deltoid here that is in the back. The rotator cuff muscles. The first one that's here, this is what's known as the subscapularis. Sub is below. The one that's Above the spine of the scapula is the supraspinatus. This is the infraspinatus. This smaller muscle that goes here this way, this is what's known as the teres minor. So you have the teres minor and the teres major, right? Because this one is smaller compared to this one. Or the bony landmark that's right here, this is what's known as the coracoid process. This is what's known as a tendon. So make sure you're not mixing up tendons and ligaments. Tendons are muscle to bone. Ligaments are bone to bone. So this would be a tendon. Yes, so this is a tendon. Both of these are tendons for the biceps brachii. So you have a short head and you have a long head for the biceps brachii. Just remember that the long head is lateral, which would make the short head medial. This is the short head, which attaches on the coracoid process, and this is the long head, which attaches on the supraglenoid tubercle of the scapula. So if this is the coracoid, that would make this muscle, which is number 15, the coracobrachialis, because it's going to the brachial region, which is the upper part of the arm. This muscle is only in the upper arm, so it's known as the brachialis. So it's a deep muscle. So it's there, and then you can see it laterally here. So this is it's number 14, that's right there. The posterior side, this is the triceps. For the biceps, there's two heads, so they call it the biceps. For the triceps brachii, there are three heads. You have a long head, you have a medial, and a lateral head. This is the long head of the triceps. So which one would this be? The medial or the lateral? Orient yourself. What are you looking at? This is a posterior view. This is the medial border of the scalp. Yes, so that would make it, this would be the medial. And then this would be the lateral head of the tricep. This here is the distal end of the humerus. The first thing that I need to do is understand what is medial, what is lateral. And so I do that by looking at the ulna, because the ulna directly articulates here with the humerus. What you're looking at, this is a right arm, because this is the ulna and this is the radius. If I know that this is the medial side, I know that both of these are epicondyles, but I know that this one is the medial epicondyle and this is the lateral epicondyle on this side. The rule of thumb here for the flexors and the extensors of the forearm is that the flexors are on the medial epicondyle. The extensors are on the lateral epicondyle. The lateral epicondyle is here. The medial epicondyle is here. Based off of what I just said, this muscle is known as the brachioradialis. So let me bring this a little bit closer. So this is the brachioradialis. It's going from the brachial region to the radial side, which is the thumb. Would this be an extensor or would this be a flexor if it's on the lateral epicondyle? Yes, if it's lateral, that means that it's an extensor. By knowing this, the names will kind of indicate for the forearms the action of the muscle. This muscle is an extensor, so it's the extensor. It goes past the carpal bones, so it's the extensor carpi. It's on the thumb side, so radialis, and it's long. So it's the extensor carpi, radialis, longus. If this is the ECRL, that would make this one the brevis, the extensor carpi radialis brevis. So looking at number 30, we already know this is an extensor. Because it's right here and you follow it all the way along, it's going to the digits. So it inserts at the phalanges. If it's an extensor and it's going to the phalanges, this is the extensor digitorum. Over here, this is what we have, which is known as the anconeus. And this one, number 32, this is going to the pinky side. What would be the name of this? It would be it's on the lateral epicondyle, so it's a extensor. And if it's on the pinky side, it's ulnaris. Yeah, so it's the extensor carpi ulnaris. By knowing the name, that's what's going to tell you what the muscle is going to do, right? Because it's helping to move the wrist, right? My extensors. because we already said if it goes past the joint, that's what's going to help to move it. So if the muscle or the tendon goes past the joint, that's the muscle that that's the joint that it's going to alter the movement. We did the extensors, now let's go back to the flexors. What I look at from this point of view, I look at this little triangle here. So this is what's known as the pronator teres, number, I think that's 21 or 22. But so this is known as the pronator teres. So pronation is when you pour the soup out. So when you go like that, it's pronation. So you have the pronator teres. This is going to the thumb side. It's off the medial epicondyle. So what would be the name of this muscle? Flexor carpi radialis. So flexor carpi radialis. This muscle that's here down the middle, this is known as the palmaris longus. So if you go like this, so if you kind of make that, you can see the palmaris longus tendon that's poking out. So this is the palmaris longus. The muscle here that's deep, this is a flexor. So it's going to the digits. So it's the flexor digitorum superficialis. You also have the profundus, which is deep. Here, this is going to the pinky side. I know that it's a flexor. So it's the flexor carpi ulnaris, which is right there. Tendon right here is from the latissimus dorsi.